Hello, everyone, and welcome to the Lean Healthcare. I'm so excited to launch this channel and share my passion for applying lean principles in healthcare. In this two-part series, we'll be diving into the basics of lean methodology and exploring its powerful impact on the healthcare environment, especially from hospitals' perspective. Part one provides a foundation in lean principles and methodology, and in part two, we'll tackle a real-world case study, how to drastically improve patient discharge times using a single piece flow versus a batch processing. I have focused on keeping things simple, practical, and to the point. So you will walk away with a clear understanding of how lean, from its roots in the Toyota production system, can truly transform healthcare and deliver exceptional value to our patients, who is our ultimate customers. Before we dive in, here's a QR code to subscribe to the channel and stay updated on the future videos about lean in healthcare. I'll pause on the QR code for 5 seconds. I request you to subscribe to the channel so that you can start getting notifications for my new videos on lean in healthcare. Here you go. Please do subscribe. Thank you. Have you ever wondered how manufacturing principles could revolutionize healthcare? I'm Mohammad Jaid Alam. I'm an industrial engineer and Lean Six Sigma Master Black Belt with 16 plus years of experience. And after a decade in manufacturing and oil and gas, I transitioned to healthcare to bring those proven lean methodologies to a field that desperately needs them. How there's one thing that I want to say, which is very important, is healthcare runs on people, but wastes billions on inefficiency. What if we could apply the same lean principles that transformed manufacturing? So, what you will learn in this part one, you will master the foundational lean principles, which is reshaping the healthcare. And the part two, we'll see how a single piece flow slashes the discharge delays by 50% versus using a batch processing. This powerful quote by Shinjo, a pioneer of the Toyota production system, really gets to the heart of lean thinking. The most dangerous kind of waste is the waste we do not recognize. Think about that for a moment. This is especially true in healthcare, where unrecognized waste can have a significant consequences. These hidden wastes are the most dangerous because of they silently erode our efficiency, increase cost, and potentially impact patient care without us even realizing it. Imagine the time wasted searching for misplaced charts, the duplicated efforts from unclear communication, or the delays caused by inefficient workflows. These seemingly small wastes add up, impacting patient wait times, staff frustration, and ultimately the cost of care. In the following slides and sections, we'll explore the different types of waste in healthcare and learn how to identify them so that we can begin the process of elimination. In this first part of the video series, we'll lay the groundwork for understanding how lean thinking can transform healthcare, and we'll be covering several key areas. First, we'll define the core principles of lean and explore how they translate to the healthcare environment. It's crucial to understand the foundation before we deep dive into the practical applications. And then we'll discuss what true value means from a patient's perspective. This is the central focus of lean, delivering the maximum value to the patient. And next, we'll delve into the concept of lean waste. We'll identify the different types of waste commonly found in healthcare processes and discuss why recognizing them is so crucial, as we discussed with the Shinjo's quote. And finally, we'll compare two fundamental ways of organizing work, let's say discharge process, batch processing and a single piece flow. Understanding the difference between these two approaches is essential for implementing lean effectively. This first part will give you the necessary background to understand the practical application that we'll explore in part two. And in part two, we'll put the lean principles we have discussed into action with the practical case study. We'll be conducting a simulation focused on the inpatient discharge process. This is a critical area in hospital as efficient discharge directly impacts patient flow, bed availability, and overall hospital efficiency. Before we dive dive deeper into the specifics of lean, it is important to understand the broader context of quality improvement in healthcare. The Institute of Medicine Crossing the Quality Chasm report provide a valuable framework for this. This landmark report identified six key aims for improving the healthcare system, and these aims align perfectly with the goals of lean thinking. By focusing on these six aims, we can ensure that our lean efforts are directed towards making a real and meaningful difference in patient care. The IOM 6 aims paint a picture of what truly healthcare, what truly high quality healthcare looks like from a patient perspective, which also resonates strongly with the principles of lean. Safe. Patients should feel confident that they will not be harmed by the care they receive. Effective. Patients should receive the care that is proven to work best for their condition. Patient centered. Patients should feel heard, respected, and involved in their own care decisions. Timely. Patients should not experience unnecessary waits or delays in receiving the care. Efficient. Healthcare resources should be used wisely to minimize cost and maximize value. Equitable. All patients, regardless of their background, should receive the same highest standard of care. And Lean helps us make this vision a reality by providing the tools to eliminate waste and optimize processes, ultimately leading to a better patient experience. Lean methodologies, have gained a significant traction in healthcare as a means to enhance efficiency, reduce cost, and most importantly, improve patient care. Several key drivers, underpin the adoption and successful implementation of lean in healthcare settings. Define value based on the voice of the patient, which is our customer. So in lean, value is always defined from the customer's perspective. In healthcare, our customers are the patients, and understanding what patient truly value is paramount. I mean, this goes beyond just clinical outcomes. It encompasses the entire patient experience. So what do patients value? Timely access to care, effective communication, respectful and compassionate care, comfortable and safe environment, efficient and coordinated care. And by actively seeking and incorporating the voice of the patient, healthcare organization can ensure that their lean efforts are focused on delivering what truly matters. The second is create an environment that supports the staff. The lean recognizes that engaged and empowered staff are essential for driving continuous improvement and delivering high quality care. When the staff feel supported and valued, they're more likely to be engaged in improvement efforts and committed to providing excellent patient care. What next? Eliminate all forms of waste. Waste in healthcare refers to any activity that consumes resources but does not add value for the patient. We will deep dive into waste in further slides, but systematically identifying and eliminating these waste, healthcare organizations can improve efficiency, reduce cost, and enhance patient flow. And the last is delivering excellent clinical quality. Ultimately, the goal of lean in healthcare is to improve clinical quality and patient outcomes. By focusing on these drivers, healthcare organizations can achieve significant improvements in efficiency, quality, and patient satisfaction. So these four drivers are interconnected and mutually reinforcing. By focusing on these drivers, healthcare organizations can create a culture of continuous improvement and deliver exceptional value to the patients. What is lean? So this slide sort of defines lean in a nutshell, focusing on value and eliminating waste. Lean thinking asks us to look at every step in a process from a patient perspective and ask question, does this step improve their experience? Does it contribute to the healing or well-being? If not, it's considered a waste. Long waits, unnecessary paperwork, and being moved around unnecessarily, these all are sources of frustration for patients. They don't add value to their care. What patients do value is effective treatment, clear communication, and timely care. These are the activities we want to focus on and optimize. Lean helps us identify and eliminate the non-value added activities so we can focus our resources on what truly matters uh, to the patients. So, lean thinking is built upon two fundamental pillars that work together to drive sustainable improvement: respect for people and continuous improvement, which is often expressed as eliminating waste. So these are not just separate concepts, they are deeply intertwined and mutually reinforcing. You can't truly, have one without the other. Respect for people is the foundation upon which all lean efforts are built. It's about recognizing the inherent value and potential of every individual within the organization. And it is important to note that, respect for people is not just a soft skill. It's a driver of engagement, motivation, and ultimately better patient outcomes. When people feel valued and respected, they are more likely to be engaged in their work, committed to quality, and focused on delivering exceptional patient care. The second core principle of lean is the relentless pursuit of eliminating waste and continuously improving processes. This is often referred to as kaizen in Japanese, which means change for the better. In lean, waste refers to any activity that consumes resources but does not add value for the customer. In our case, which is the patient. So these two pillars, respect for people and continuous improvement, are the foundation of lean thinking. They're interconnected and essential for achieving sustainable improvements in healthcare. This resonates deeply with me. A true lean thinking and leadership is not about directing every action, but empowering individuals to identify opportunities, solve problems, and contribute meaningfully. When we invest in developing others' capabilities, we not only improve organizational performance, but also foster a culture of growth and respect, which is one of the pillars of lean. Creating a truly safe environment for our staff goes beyond just physical safety. It encompasses a holistical approach that considers their well-being in all aspects of their work. This is achieved by focusing on four interconnected elements: meaningful work, a reasonable workload, a safe work environment, and a culture of respect, which we'll explore in detail in further slides. So, what does meaningful work mean? In a hospital, this means ensuring staff understood and understand how their work directly impacts patient care and the overall mission of the organization. It involves providing opportunities for professional growth, recognizing contributions, and fostering a sense of ownership in their work. And examples include like involving staff in improvement projects, providing regular feedback, and celebrating successes. When the staff find their work meaningful, they're more engaged, motivated, and committed to providing high quality care. This leads to improved patient outcomes, reduced staff turnover, and a more positive work environment. All right, a reasonable workload. This means ensuring staff have a manageable workload that allows them to perform their duties safely and effectively without say, excessive stress or burnout. It involves appropriate staffing levels, efficient workflows, and minimizing non-value added tasks. This might involve implementing a standardized work procedures, optimizing resource allocation, and addressing process bottlenecks. A sustainable pace prevents errors, reduce staff fatigue and stress, and promotes a healthy work-life balance. I mean, this improves patient safety, reduce absenteeism, and fosters a more positive and productive work environment. Safe work environment. This encompasses both physical and psychological safety. Physically, it means providing a hazard-free work environment with appropriate equipment, training, and procedures to prevent accidents and injuries. Psychologically, it means fostering a culture where staff feel comfortable speaking about concerns, reporting errors without fear of reprisal, and receiving support from colleagues and leadership. This could involve regular safety training, incident reporting systems, and promoting open communication. A secure and supportive setting is crucial for preventing harm to both staff and the patient. It fosters trust, encourages open communication, and promotes a culture of continuous improvement. Culture of respect. This is very close to my heart. This means fostering an environment where all staff members are treated with dignity, fairness, and respect, regardless of this role or background. It involves promoting open communication, active listening, and valuing diverse perspectives. This might involve implementing diversity and inclusion initiatives, promoting respectful communication training, and establishing a clear conflict resolution process. A collaborative and inclusive culture will foster teamwork, will improve communication, and enhance staff morale. And it also creates a more welcoming and supportive environment for patients and their families. Now, by addressing all four areas and four of these elements, meaningful work, reasonable workload, physical safety, and a culture of respect, we create a truly safer and more supportive environment for our staff, which ultimately translates to better patient care. This powerful quote by Taichi Ono, the father of Toyota production system, gets to the heart of what lean is all about, focusing on how flow of value to the customer. But Taichi Ono was speaking about manufacturing. This quote, all we are doing is looking at the timeline from the moment the customer gives us an order to the point we collect the cash, and we're reducing that timeline is equally relevant to healthcare. We just need to translate it slightly. In healthcare, the order could be a patient's initial appointment request, and collecting the cash could represent the patient's successful recovery and discharge. Our goal is to reduce the time it takes for a patient to move through the entire healthcare processes, from initial contact to the recovery. This means minimizing wait times for appointments, tests, treatments, and discharge. And by focusing on this timeline, we can improve patient flow, reduce delays, and provide more timely and effective care. This visual starkly illustrates the current state of many healthcare processes. We are looking at a patient journey from the moment they enter our system, the patient in, to the moment they leave, the patient out. As you can see, the majority of the steps are highlighted in red, representing waste. These are activities that consume time, resources, and efforts, but don't add direct value from the patient's perspective. The few green blocks represent the value added activities, the things that truly contribute to the patient care and recovery. This visual highlights the urgent need for process improvement and the power of lean methodologies to reduce waste and maximize value for our patients. By applying lean principles, we can transform this picture, reducing the red and expanding the green, creating a more efficient and effective healthcare system. So when we talk about eliminating waste in lean, it's helpful to categorize it into three distinct types, known as three M's: Muda, Mura, and Muri. Understanding these categories helps us identify and address the root causes of waste more effectively. So, muda, waste. Muda is the most well known of the three. It refers to activities that consumes resources but do not add any value for the patient or for the customer. And Taichi Ono originally identified seven types of muda, which have since been expanded to eight in some context. We'll explore those eight ways one by one in further slides. The next is mura, which is unevenness, inconsistency. Mura refers to the unevenness or inconsistency in a process. This can be caused by fluctuating demand, inconsistent workflows, or unreliable equipment. So Mura leads to uneven workloads for staff, sometimes leading to overwork, and other times to idle time, and inconsistent quality and delivery times, and increased stress and frustration for both staff and customers. So addressing Mura often involves implementing standardized work, leveling workloads, and improving process stability. The last is Muri, which is overburden or strain. A Muri refers to overburdening people or equipment. This can be caused by excessive workloads, unrealistic deadlines, or poorly designed processes. A Muri results in increased risk of errors and accidents, staff burnout and decreased morale, equipment breakdowns, and increased maintenance cost. Addressing Muri often involves redesigning processes to be more manageable, providing adequate resources and training, and setting realistic expectations. It's important to understand that the three M's are interconnected. The Mura, which is unevenness, often leads to both Muda, which is a waste, and Muri, overburden. For example, fluctuating patient demand, Mura, can lead to staff waiting during slow periods. A Muda is a waste, and then being overworked during peak times, which is Muri. By addressing all three types of waste, we can create more efficient, stable, and sustainable processes that deliver greater value to our patients and support our staff. So, lean waste in healthcare. The lean waste in healthcare are any actions, processes, or use of resources that consume time, effort, or material without directly contributing to positive patient outcomes or enhancing their experience. These wastes hinder efficiency, increase cost, and detract from value we strive to deliver to the patient. In Lean, we focus on eliminating waste, which we categorize into eight key types. These are often remembered by the acronym TEAMWOOD or TEAMWOODS when we include skills, non-utilized talent. Understanding these waste is crucial for identifying areas for improvement in any processes, especially in healthcare. We'll now briefly introduce each of these waste and then we'll delve into each one individually on the following slides. Transportation waste is unnecessary movement of patients, materials, or information. Inventory is excess supplies, equipment, or information. Motion is unnecessary movement of people, staff, or patients. Waiting is the time spent waiting for the next step in a process. Overproduction, producing more than is immediately needed. Overprocessing, doing more work than is necessary. Defect, errors that require rework or correction. Skills non-utilized, not using people's uh, skills and abilities effectively. Now let's take a closer look at each of these waste, starting with the transportation. The transportation waste refers to any unnecessary movement or transportation of patients, staff, equipment, or material within a healthcare facility. It's about minimizing the distance things need to travel to get where they need to be. This phase does not add any value to the patient. It simply consumes time, resources, and potentially increase the risk of errors or delay. So this could involve another is the unnecessarily patient movement, for example. This could involve transferring patient multiple times between departments for different tests or procedures when some of these could be consolidated or brought to the patient. For example, A patient might be moved from their room to the radiology for an X-ray, and then to a different department for a CT scan, and then back to their room. And when perhaps portable X-ray or better scheduling could reduce these moves. This not only wastes staff time, but can also be uncomfortable, even risky for patient, especially those who are frail or have some mobility issues. And let's say another example of misplaced supplies. When supplies are not stored in a logical, easily accessible location, staff waste time searching for them. This is a form of transportation waste because staff are moving unnecessarily to find what they need. Imagine a nurse, having to walk to a central supply room multiple times during a shift because commonly used items are not stocked near the point of use. And this takes time away from direct patient care and increase the risk of delays. Specimen transport inefficiencies. Delays or inefficiency in transporting specimens in the lab can lead to delayed diagnosis and treatment. This is a classic example of transportation waste. For example, if the samples are transported in batches at set times rather than using a more continuous flow system, there can be significant wait times before testing begins. This can have serious implication for patients who need urgent results. Same, when we overstock inventory, we often end up having to transport unused item back to central storage area or even return them to supplier. This is a clear waste of transportation. So transportation waste, if I want to summarize, can lead to increased staff workload and fatigue, delays in patient care and increased wait times, higher cost due to inefficient use of resources, and increased risk of errors during transportation. So how to reduce the transportation waste? Some strategies I have just listed down. You can optimize the facility layout to minimize distances between frequently used areas, implementing a point of use storage for commonly used supplies, using pneumatic tube system, which is being used in many of the new hospitals these days, or any other automated transportation method for specimens and documents, and improving scheduling coordination to reduce the unnecessary patient transfer. Inventory waste. Inventory waste refers to having more supplies, materials, work in process, or medications than are needed at a given time. It's about having excessive stock that ties up valuable resources in space. It might seem like having extra inventory provides a buffer against shortages, it actually creates a number of problems. For example, excessive stock of medications. When you hold large quantities of medications, it can lead to uh, expiration of medicine, requiring disposal and resulting in financial loss. It also ties up, capital that could be used for other essential needs. Or for example, a hospital might stock large quantities of a specific antibiotic, but if a new, more effective antibiotic comes on the market, the older stock may become obsolete and have to be discarded. Ordering excessive surgical supplies, specialized or expensive items can lead to a significant waste if they're not used before the expiration date or if surgical procedure is changed. For example, if a hospital overstocks a specific type of surgical implant and the surgical technique changes, those implants may become unusable. And orders waiting to be processed. This is very interesting, and this is a less obvious form of inventory waste. Orders waiting to be processed, whether for lab tests, prescriptions, or supplies, it represents a work in process inventory. Those pending orders create delays and bottlenecks in the system. They also consume resources such as staff time and that is consumed in managing the backlog. For example, if lab orders pile up waiting to be processed, it delays diagnosis and treatment plans, negatively impacting the patient care. Another is our stock of disposable items. I mean, excessive quantities can lead to storage issues, expiration, and even damage due to improper storage conditions. For example, if a clinical overstock disposable gloves and they are stored in a humid environment, they may become unusable due to degradation. So, what is the impact of inventory waste? Inventory waste often leads to increased cost due to spoilage and storage, tied up capital that could be used for other investments, increased risk of errors due to confusion or outdated items, and wasted storage space. How to reduce inventory? Some strategies are implementing just-in-time inventory system, improving demand forecasting and ordering processes, using inventory management software or to track stock levels and expiration dates, establishing clear storage protocols to prevent damage and spoilage. Now let's talk about motion waste. Motion waste refers to any unnecessary movement of people, whether staff, patient, or visitor, that doesn't add value to the process or service being delivered. It's distinct from transportation waste, which focuses on the movement of things. This type of waste is usually overlooked, but it can have a significant impact on efficiency and staff fatigue and even patient safety. For example, and searching for items. This is a very, very common form of motion waste in healthcare. Staff members wasting time searching for misplaced charts, files, equipment, or supplies. Imagine a nurse searching for a specific type of bandage because the supply closet is disorganized. This takes time away from the direct patient care and can add delays in treatment. This can be easily addressed by implementing 5S methodology. Which you might be aware of. Maybe later on I'll make a video on that. How can we implement 5S in healthcare? Uh, Basically, 5S: sort, set in order, shine, standardize, and sustain. Unnecessary reaching or bending, poorly designed workplaces or poorly positioned equipment can force staff to make unnecessary reaching, bending, or twisting motions. For example, if frequently used supplies are stored on a high shelves or in a low drawers, staff may have to strain themselves to reach them, increasing the risk of injuries. Multiple trips to the same location. Example, a nurse might have to go back and forth to the medication room several times during medication administration because they didn't bring all the required medications and supplies with them initially. It's a waste of motion. It wastes valuable time and disrupts the flow. Another example, while like moving portable X-ray or ultrasound machine, if the machines are not stored in a convenient location, or if there's no standardized process for the use, staff may spend unnecessary time transporting and setting them up. So how does it impact? It increased staff fatigue and potential for injuries, reduced efficiency and wasted time, delays in patient care, and decreased staff morale as well. And how to reduce the motion waste? Some of the strategies are like optimizing workspace layout, implementing 5S methodologies, using mobile carts or trays to carry necessary supplies, and standardizing procedures and workflows. Waiting waste is one of my favorite waste, and it refers to any ideal time when people, whether patient or staff information, equipment, or materials are not being actively used or processed. It represents a significant source of inefficiency and frustration in healthcare. It's a chronic problem across the hospitals. And this is very, very disturbing waste because it often hides in plain sight. We become so accustomed to waiting in certain situations that we don't even recognize it as a problem. For example, patient waiting for appointments. Long wait for appointment, whether with specialist or a primary care physician, are a common source of patient dissatisfaction. For example, a patient needing to see a cardiologist might have to wait several weeks for an appointment. And let's say the patient is in the hospital, he may have to wait sometimes several minutes to see the doctor. Waiting for test results. Delays in receiving lab results, x-rays, other diagnostic information can significantly impact the patient journey. Imagine a patient waiting for a biopsy result to determine if they have cancer. The waiting period can be incredibly stressful and emotionally taxing for the patient. Waiting for beds or rooms. In emergency departments in hospitals, patients often experience delays waiting for available beds or rooms. This can lead to overcrowding in the ED, increased patient discomfort, and delays in receiving the appropriate care. For example, a patient admitted through ED might have to wait for hours before a bed becomes available on a medical floor, and medical uh, waiting for information or decision. For example, a surgeon might be ready to operate but has to wait for the patient medical record to arrive, causing a delay in the procedure. So it has many impacts like patient dissatisfaction and anxieties increase. It delays the diagnosis and treatment. It reduces staff productivity and morale, increase cost due to inefficiency, uh, inefficient use of resources, and increased length of stay for inpatients. How to reduce waiting waste? Some of the strategies are improving scheduling and appointment systems, streamlining processes and workflows, improving communication and coordination between departments, implementing electronic health records and other technologies to improve information flow. Overprocessing refers to any effort that does not add value to the patient or the service being provided. It's about doing more work than is required or using overly complex methods when simpler, more efficient ones uh, are sufficient. And this waste can be subtle as it often involves activities that seem important but don't ultimately benefit the patient. For example, ordering redundant lab tests, x-rays, or the other diagnostic procedures that don't provide new information for diagnosis or treatment is a common example of overprocessing. Another example is repeating a blood test that was recently performed at another facility, and when the results are already available, now this is unnecessary and exposes the patient to additional discomfort and cost. Excessive excessive documentation. Having nurses document the same information in multiple locations in the electronic health record or requiring excessive sign off on routine tasks, it creates unnecessary work. Multiple approvals or sign offs requiring unnecessary layers of approval for routine tasks or decisions can create bottlenecks and delays without adding any real value. For example, requiring multiple levels of management approval for routine supply orders or a simple patient request can slow down the processes and frustrate staff. So our processing leads to increased cost due to unnecessary resource consumption, reduced efficiency and longer lead times, increased staff frustration and decreased morale, and potential for errors are increased due to overly complex processes. And how to reduce our processing waste? Some strategies are standardizing procedures and workflows, simplifying documentation requirements, using technology to automate tasks and reduce manual efforts, empowering staff to make decisions at the appropriate level, regularly reviewing the processes to identify areas for simplification. Overproduction. In lean thinking within healthcare, particularly, this waste refers to providing more of a service or resource than is immediately required by the patient or the process. It often leads to excessive inventory, wasted resources, and increased cost. For example, ordering excessive supplies, stocking large quantities of medical supplies or medications that may expire, pre-printing large number of forms, printing excessive amount of forms that may become outdated and go unused, making more meals than needed, preparing extra meals that end up being wasted due to changes in patient status or dietary needs, or generating excessive reports or documentation which are not immediately used or contain some redundant information. Some of the strategies, how can we reduce our production waste, is like implementing just-in-time inventory management by avoid ordering excessive supplies by using real-time tracking and demand forecasting. Use automated system to reorder stock only when needed. Switch to on-demand or digital forms. Replace pre-printed forms with electronic records. Reduce paper waste. Adapt the flexible meal planning or portion control. Use patient census data to adjust meal production daily. Implement a meal ordering system, where patient can select meals in advance, and follow evidence based guidelines and utilization reviews, reduce unnecessary tests procedures by following clinical guidelines. Defect. In lean thinking, the defect waste refers to errors or mistake that require rework, correction, or additional resources. It represents a significant source of inefficiency and can have serious consequences of patient safety and outcomes. For example, medication errors, administering the wrong medication dose or route to a patient, surgical errors, performing the wrong procedure, operating on the wrong site, or leaving surgical instrument inside a patient. It's a defect. Diagnostic errors, misdiagnosing diagnosing a patient condition or failing to diagnose a condition in a timely manner. Laboratory errors, incorrectly labeling or processing samples. Documentation errors, recording incorrect information in patient charts or medical records. Hospital acquired infections that patient acquired during their stay in a healthcare facility. These all are defects in a healthcare facility. So, what are the strategies? Some of the strategies are like implementing a barcode scanning and e-prescribing system that helps us reduce the medication errors, ensure 5 rights of medication administration, right patient, drug, dose, route, and time, enhance diagnostic accuracy with AI and second opinions, like using AI assisted decision support tools to reduce diagnostic errors, strict adherence to the infection control protocols, prevent hospital acquired infections with hand hygiene compliance, sterilizations and isolation procedures and protocols, and reduce documentation errors by structured electronic health records and training staff on proper documentation practices and auditing records regularly. This is the last waste of lean that we'll discuss today. In lean thinking, particularly within healthcare, skills non-utilized waste refers to the underutilization or misapplication of staff skills, knowledge, and abilities. It represents a significant loss of potential and it can negatively impact efficiency, quality, and staff morale. For example, a registered nurse spending a significant amount of time on administrative tasks or clerical work that could be done by less qualified personnel is a waste of resource. Another is a lack of cross training. Staff members are limited to specific tasks within their job description, preventing them from contributing to other areas. Another is limited opportunities for, say, professional development. Staff members are not given opportunities to enhance their skills or learn new ones. And lack of empowerment and autonomy. Staff members are not given the authority or responsibility to make decisions or implement improvements within the scope of practice. These all are examples of skills non-utilized ways, and some of these the strategies that can be used are optimize staff roles through skill assessment and role redesign, implement a cross training and upscaling program, train staff in multiple roles. For example, nurses can learn phlebotomy, close handling, basic triage, and encourage multi-skilling. Another is allow frontline staff to make processes improvement, use leadership principles to delegate authority appropriately, and let's say conduct daily hurdles and interdisciplinary rounds to improve collaboration. So all of these strategies will help us eliminate uh, the waste of skills non-utilized, and it will give opportunity to all the frontline staff and healthcare workers to contribute to the better delivery of value to the patient. So in lean thinking, particularly in healthcare, as we can see that this slide we have seen before as well, what will happen eventually when you will identify all those 7 waste or 8 waste that we identified, and you will gradually eliminate all those wastes from the processes. Eventually you will have a process that you can see, the second line with lesser reds and more greens. So basically you will minimize the non-value adding activities or waste that do not add any value to the patient, and you keep on maximizing the activities that adds value to the patient. And the aim of implementing lean thinking is to maximize value for the patient by eliminating waste in all processes, thereby improving efficiency, safety, and overall quality of care. It strives to create a patient-centered system that delivers the right care at the right time in the right place. This is the value you get by understanding the seven waste in healthcare that helps you identify those waste from the processes. Now, I would like to thank you for joining me in part one of Lean in Healthcare. And very soon, I'll be releasing part two. I'll walk you through a real world case study on how single piece flow versus a batch processing actually can dramatically reduce the inpatient discharge time. I would want you to stay tuned, and I want you to help spread the knowledge. Uh, if you found this video useful, please share it with your network and follow my channel for more lean healthcare insights. Thank you once again. See you in the next video. Again, please subscribe to the channel, and very soon I'll be posting part two, where actually I'll walk you through the real practical case study of reducing the patient discharge time, lead time by more than 50% by implementing a simple technique or a methodology of single piece flow. Thank you everyone. Have a nice day.